I've been doing this for over 20 years, and this past year was one of the most different in every aspect, clinically, personally, professionally, as far as my ministry work. You know, everything shut down. We were so busy, and we were seeing everybody outside. And of course, as we know, it was April and it was pretty weather. The summer, it was Mississippi hot, and we were patients were having to sit in their cars. If they were sick at all, we had to see them in the vehicle. And then it was wintertime, and I know that I bought my girls Cuddle Duds, the Furline Cuddle Duds. We put a tent up outside. I bought raincoats for them because it was probably the wettest, coldest winter we've had. Maybe it just seemed that way because we were outside all day, but we rolled with it, with whatever. And it was hard because you're inside. I worked in insulated camouflage coveralls, and you're outside freezing to death, and you come in and then you're hot, and then you go back out, and that was just being at work all day was such a different. And no mission trips. I got back from Kenya in November of 19, and I haven't been anywhere or done anything until in July. I'm going back to the Dominican, but churches closed and we couldn't gather, and everything that I serve on, we either met through Zoom or didn't, just kind of shut down. So it was just heck of a year. Don't want to do that again. Not signing up for that. Our boundaries were stretched, and I think we kind of know what we're capable of now.
I would come home and tell my wife, okay, today's the day. I tested the whole family, they were all positive. Surely with me crawling in the back of that car and checking that kid's ears, today's the day I got it. And that was hard.
We're a small clinic, so we need everybody there every day. And at the beginning of it, I told the girls, I said, you do know that every one of us is going to have it before it's over with. It's, really, we are in some way, shape, or form. And I said, but what I need for us to do is only have it one at a time. Where there's only one of us out for 2 weeks at a time. Make sure we stagger ourselves. And fortunately we did. And every one of us except for one had COVID. But we weren't sick. I mean, we may have felt bad, but we did not have it horribly bad. And but it was at the beginning. I said, we're going to get it. We can't help it. Like you crawling in the back seat of a car and swabbing a kid that just blows snot everywhere. It's going to happen. It had to happen.
I struggled, emotionally. But I think my main concern then and now are the children. And I don't know what you've seen, but some of those kids, the only smile they saw was at school or from those teachers and administrators, and I haven't seen a whole lot of peds since things have been kind of opened back up, but I'm more concerned about them and the older people that all of a sudden they couldn't go to ball games and they couldn't hug their grandchildren.
I feel like there was a lot of uncertainty. I couldn't answer the questions. You need this medicine, you need this treatment. Look for these symptoms. My first COVID patient only had back pain. That was it. I lost a lot of patients during COVID, and that was hard. Their spouses came down with it. I cared for them for 10 years and had this virus, and they were no longer with us. When the antibodies started coming out, people would come and just want to get the antibodies. So there was a lot of anxiety, anxiousness, and what can I do, what can I not. Patients didn't show up for appointments because they were scared of getting sick. Meanwhile, they weren't getting their insulin or whatever they needed. As far as peds, I treat a lot of adolescent, not so much the younger generation, but I probably had more anxiety and depression in the teen group than I ever have. I reached out to Dr. Dodd a few times because it's hard to treat a teenager for depression and anxiety. They already have so much, so many emotions and feelings at that age, and then being social beings is what they're all about, and we cut that from them. So I think I probably treated that more than I ever had in my career. It is definitely getting better, but it's still a hard population to treat.
And the great thing about children, as we all know, is that they're very forgiving and they're very resilient. But I think we've been seeing some of the younger ones, symptoms that, to the trained clinician we know is manifesting anxiety and other things. Whereas parents, they're like, gee, this once precious child who was always so obedient and listened so well, why are they acting so different? And I know that Alcorn County Schools and Corinth District Schools, I think, did an excellent job of basically trying to create the safest environment possible to allow school to continue. I think they gave parents great options to either attend in person and know that their children would be safe, or if the parents didn't feel comfortable, to allow it virtual. So I agree, there's probably going to be some long-term consequences from these children attending virtually, but thankfully with vaccines and all the hard work that the school districts put in making sure that things were safe, I'm hoping that we're seeing the light at the end of the tunnel there. That we're going to get kids back in. And like I pointed out, the great thing about kids is they are resilient.
They are.
And so they have shown an incredible spirit to, despite this, if you can name that emotion and say, hey, this is what you're feeling, this is why, and here are some things we can do to help. And oh, by the way, you don't have to talk to your mom and dad or your peers over social media or Skype or anything else anymore. How about you speak to this trained professional? And to see them be able to say, hey, I didn't know that was what was going on. Thanks for helping me figure that out. And then being comfortable saying, I didn't know I had anxiety and now I'm better. That was a wonderful, it's a wonderful privilege to be able to be that person that helps somebody get that care. Treating infections and antibiotics, that's pretty rewarding. But to be able to help somebody understand these really strong emotions that they're feeling that they can't explain.
And at that age, they don't know the words to use. They don't know how to tell you what they're feeling.
Some adults even struggle with that.
Exactly. But that they just don't know how to tell you that I'm feeling this or I'm thinking this. I know in our area, we have some children that I worry about a great deal. Just not being able to go to school because that's where they get a warm meal. That's where they get their 2 meals a day that are hot meals, and they count on that. And with them, I saw worry. Where am I going to eat? What am I going to eat? And fortunately, we have a program through it's outside of the school, but it's with fuel, and they carried hot meals. We carried pizza. I got to help a little bit with that to just make sure that those kids had, and any kid that needed it, but there are some subset populations that we really worry about, and we were able to hopefully keep that fear and that worry, because there's nothing, I can't imagine anything being any scarier than going to bed tonight and maybe hungry and not knowing if I'm going to be even hungrier tomorrow night. Our community at Kossuth is amazing. We have, and I know that all over Corinth, but for our community at Kossuth, it is incredible. But we had patients that would drop us off lunch. Were we going hungry? No, we weren't, but the thought, and we were working through lunch a lot of days. You just kept working and kept pushing through. And just the fact that they thought of us and, just to do something kind, what meant a lot. The team coming together, working together was incredible. We spent a lot of time elbow to elbow with each other, and we're closer now than ever because we spent most of our time together.
I think the expression, it's hard to see the forest for the trees.
Mm-hmm.
We're in it every day, and to us, when we hear the term hero, I think we all kind of get a little embarrassed because to us, it's such a calling. It's a natural inclination for us to want to help. And so going to work and showing up was never a question.
Right. We
very much had the human side of, am I going to potentially expose somebody? But, to live through this time, you never want to live through something this severe. But to know that there is a light at the end of the tunnel, that we're starting to see some good treatment options through the antibody infusions, that vaccines are protective against serious infections. I know that all those things were really, it was really cool for me to see and to reflect and think, wow, I'm living through a very unprecedented time, and we're actually starting to make a difference. So.
I think we got better. Telemedicine was pretty new to our community, and we launched that to make sure patients were getting their needs met. So that's a positive that I think can be utilized going forward. If patients can't get the care that they need, at least they can talk with the provider and get their needs met. My 3 kids are at Costa, so I love the community too. And the principal and the teachers reached out to me a lot about quarantine and keeping athletes safe, and teachers reached out to me how to help their children with their fear, because they were with these kids every day. And wearing masks, that was different for these kids. So I feel like the principals, teachers, all the people involved in education really had a lot of burden on their shoulders, and they did a great job, protecting these kids and reaching out. I enjoyed working with them.
State Department of Health, the CDC, what are the rules today that we go by? And I mean, it was changing that rapidly.
I think a lot of anger, come out of it, and maybe that's what, the depression and the anxiety part, because people were upset and getting, different information from different sources, and so.
And the unknown is always scary.
It's very scary.
And it was completely unknown. And that is, patients, I know they would ask me, well, what's going to happen? I don't know. I don't know, but we'll do it one step at a time. Just stay in contact with me. And it was not uncommon for us to call them every day. And how are you today? And,
Can it change overnight?
yeah, in anything. What are your stats today? And that it's just with the unknown. And even now, people still have some residual symptoms and some residual effects. When am I going to get rid of this? I don't know. You may not ever. Maybe next week you just wake up one morning and your taste is totally normal.
Back to our clinic, I think once somebody finally had it in the clinic and was okay, I think there was some relief. I don't know about y'all, but it's like who's gonna get it first? And I think once we all kind of realized it was gonna happen and it was gonna be okay, there was a lot of relief there. And I think the patients, once they realized that we had it and we were okay, they felt a little more comfortable thinking that, if they possibly had it, that they would be okay too.
I think the point you made about telehealth is so critical, because much of the way that we practice medicine is driven by insurance, unfortunately. And sometimes great things come out of bad situations. And I know that thankfully the insurance saw fit to say, you know what, telehealth's probably a safer option. And I think that long term, a lot of people, and especially younger people, feel more comfortable with technology. But taking away that barrier to travel and taking away that barrier to take time off work for parents, allowing people to access quality mental health services through telehealth and being reimbursed for it is the key, which makes it sustainable. I think long term going forward, if there's a bright spot coming out of this pandemic, that's going to be the one. And so the state of Mississippi, I know, has received some grants to make at least a minimum number of mental health visits for all children less than 18 available. I'm certain we can get that information to people. But I think that people need to know that accessing mental health is not as difficult as it used to be. And hopefully through this, people realize that there shouldn't be a stigma attached to it. It's no different than getting your broken arm fixed or treating an upper respiratory infection. Going and taking care of your mental health is critical.
But you hit it right there. There's such a stigma in this part of the country attached to mental health. You go to another part of the country and they have their therapist card on them and say, you need to go see my therapist. Here, therapist, what? I don't know. I've never, and it's okay. It doesn't mean anything. It means that you are reaching out for help and getting it. But there is such a stigma, and I'm hoping we have more providers now and more access and easier access. And I hope, if anything, that we have said it enough times, it doesn't mean anything bad or negative.
They talk about growing up in the South that, when you have a problem, they say, just put your big girl panties on and deal with it. And if we can get these children and even adults to realize that there's nothing wrong with it,
So thankfully, there's some solutions that we didn't have 20, 30 years ago that we have now. So I think that's one takeaway. I think another takeaway for parents is to realize that our kids are smarter than they think they are, and they're much more perceptive. And so one piece of advice that I've given all parents during this is just to be open and honest with your children. And when they know that you're able to verbalize that, I think it puts them at ease that they're not misreading the situation. So being, as parents, we can model that good behavior for our children in the same way that we eat well and exercise, name our feelings, talk about them out loud. And I think that this next generation is going to be better equipped than we were to maybe handle some of those challenges.